Okay, so welcome back. Let's share the screen. Look at the next scenario. Okay, so welcome to the Genius Class 2023. Our next scenario is idiopathic raised intracranial pressure. Idiopathic raised intracranial pressure. Candidate instructions. Where you are, you're an FY2 in a GP surgery. Who the patient is, Ella Williams, age 30, has made an appointment to see you. Other information you have about the patient? None. What you must do is talk to the patient and address the concerns. Patient information. She's a 30-year-old lady who has made an appointment to see you, okay, because she has had headaches for the past 3 or 4 months. Throbbing headache, okay, throbbing or sometimes boring headache. Okay, throbbing or boring constant headache for the last 3 or 4 months. Worse when bending forward, sneezing, or coughing. The headache are also worse in the morning, but they are relieved when she stands up. He has been taking oral contraceptive pills for the past 10 years. Her weight is on the higher side, so she's obese. She has been experiencing blurring of vision as well in the past 3-4 months. So, approach to the task. Grips as usual. Then you're going to take the history. It is a headache, so you're going to take the Socrates. It's important when you're asking about the headache to ask about it, what have they tried so far? What medications have they tried? And have the medications helped? Differential diagnosis include migraine, tension headache, brain tumor, idiopathic intracranial hypertension, cluster headache, CO poisoning, medication overuse headache, giant cell arthritis. We're going to look at 2 important diagnoses because this is a chronic headache, worse when bending forward, worse in the morning, worse with the sneezing and coughing. These symptoms generally suggest raised intracranial pressure. And the 2 things we're going to look at is idiopathic raised intracranial pressure and the brain tumor. Now, so what are the features of raised intracranial pressure? First of all, the other name is called what? Benign raised intracranial pressure. The typical symptoms include young patient and typically female. Young female patient. Okay? Obese with risk factors. Okay? Obesity, irregular periods, postpartum period, or first trimester of pregnancy. The benign raised intracranial pressure may coincide with recent weight gain. May coincide with recent weight gain. A brain tumor, we're also going to have constant progressive headache, worse in the morning, worse when you cough, sneeze, or laughing. Okay, but there may also be focal neurological symptoms, patient having weakness in the legs, okay, patient having sensory loss in the legs, and on examination, you may find hyperreflexia or low tone and low power. Okay, so the symptoms will be difficult to differentiate from benign raised intracranial pressure, but the age in here is middle age or elderly patient. There is usually young patient, female with obese. Complete the other history, which include the PMAF-TOSA, the ICE, the effects of symptoms on patient life. And remember to summarize at the end of it. The effects of symptoms are important in here. Ask the patient, what do they do for their living? Have the headache affected their work, their sleep, and their daily activities? Then you perform examinations. The examinations we need include visual acuity, fundoscopy, the cranial nerves examination, neurological examination of the lower limb and the upper limb, the visual field examination. What can you find in a benign raised intracranial pressure or idiopathic raised intracranial pressure? First of all, the visual acuity may be reduced bilaterally. Fundoscopy will show papillar edema bilaterally. The cranial nerves examination may be normal, but may show the 6th nerve palsy because it takes a very long route in the brain. Neurological examination of the lower limb and the upper limb may be normal, and in particular should be normal in this particular case, which differentiated from a brain tumor. The visual field examination usually will show an enlarged blind spot bilaterally, enlarged blind spot. Now, this is a papillar edema. What you can see is very difficult to see an optic disc. Okay, everything looks red, hyperemic, and congested. Yeah, it's hyperemic, it's congested, difficult to see an optic disc. The vessels are usually dilated and they may be tortuous. Tortuous vessels, zigzag, dilated, hyperemic, and difficult to see the margins of the optic disc. Okay, so it looks congested, it looks like hyperemic, dilated vessels, and of course, not able to see the optic disc properly. You may say that everything is reddish and you can't see, basically cannot see the optic disc. So, explain to this particular patient that has got an idiopathic raised intracranial pressure. Okay, now, if we look in this particular patient, what caused the raised intracranial pressure? We're going to go back slightly to the patient information. The patient is young, 30 years of age, which differentiated from brain tumor. In benign raised intracranial pressure, they are young. Headache 3-4 months, throbbing or boring headache constant. Worse when bending forward, sneezing, worse in the morning. Yes, she has been taking combined contraceptive pills for the last 10 years. Now, generally, of course, there was a link between combined contraceptive pills, okay, and raised intracranial pressure. But recent studies have shown combined contraceptive pills do not cause raised intracranial pressure. Okay, but You need to ask about the weight gain. This patient has got high weight gain, and sometimes high weight is associated with what? Raised intracranial pressure. So it may coincide at the same time he has been gaining weight, at the same time he has developed these headaches. But it's important here to say, there's no coinciding of use of contraceptive pills and the headache. 3-4 months history of the headaches, but contraceptive pills for the last 10 years. So which means this particular patient may continue taking the contraceptive pills, or we may hold off contraceptive pills only temporarily, okay, to see if the intracranial pressure would resolve. So the patient has got benign raised intracranial pressure or idiopathic raised intracranial pressure. It is caused by overproduction of fluid in the brain. The fluid is called cerebral fluid. The cause is unknown. Therefore, it is called idiopathic. The risk factors include obesity, okay? And as we said before, associated with the use of contraceptive, but recent studies have shown not to. Okay, there are some other risk factors. Okay, this particular patient mainly is obesity. Okay, but you need to reassure them that the recent studies have not shown a link between combined contraceptive pills and raised intracranial pressure. Okay, good. Basically, high pressure in the brain, it leads to headaches, and that can cause damage to the nerve responsible for your vision, called an optic nerve, which in turn would lead to blurring of vision. So it is overproduction of fluid in the brain. The fluid called what? Cerebral fluid, which leads to what? To headaches and damage to an optic nerve, a nerve responsible for your vision. You have a risk factor, one of which is what? Having weight on the higher side. Anybody with a BMI of 30 and above need to lose weight. As part of our examination in here, which I needed to tell you, as part of our examination, we should be checking the BMI. So in here, as part of our examination, we need the BMI, the body mass index. Okay, because this we're going to need it to manage this particular patient. So we're here discussing the management. So we have explained the diagnosis. Then management, we're going to perform routine investigations, arrange an MRI scan of this particular patient, refer to the ophthalmologist because his vision is affected. He needs more detailed assessment of the visual examination. Okay, give a leaflet to the patient about idiopathic raised intracranial pressure, and we will refer this particular patient as well to the neurologist to manage this particular condition. We're going to refer to the neurologist, okay, to manage the condition. So we're going to put it on the previous one. Okay, ophthalmologist as well as the refer to the neurologist. Okay, good. So we're referring to ophthalmologists because the vision is affected. They need measurement. In order, why are you referring in there? So that your vision or your visual field can be assessed in more detail. It needs mapping of the visual field. Neurologist, this is their condition, so management of this is required by the neurologist. Offer the leaflet to the patient about idiopathic raised intracranial pressure. Advise this particular patient to lose weight as long as you measure the weight and the weight is on the higher side. If the scenario is changed to become as normal weight, then you cannot advise to do that. We don't need to stop contraceptive pills as we said in here. So they are not linked anymore, and there is no association. There is no association between contraceptive pills and intracranial pressure because the raised intracranial pressure was 3-4 months, but the contraceptive pills for the last 10 years. So it doesn't really coincide in terms of the cause. Okay, so this is why we're going to remove this particular point. It's a very important point to follow the recent guidelines. Okay, so we don't need alternative contraception. But if the patient is going to prefer alternative contraception, then of course we offer other ones, Mirena, IUCD, and the other ones. Okay, treatment is acetazolamide. So we're going to advise to lose weight. We're going to give acetazolamide. They can continue contraceptive pills because clearly they are not the cause. He has been taking them for 10 years, but the symptoms have only started in the last 3-4 months. Okay, good. But if the patient wishes to stop, then we can stop and give an alternative because of the, of course, all the studies that were linking combined contraceptive pills with the, of course, raised intracranial pressure. But we should reassure that the recent studies do not show a link between the two. If the medical treatment doesn't help, then surgical options may also be available. What surgical options are available? Here, things such as, of course, stenting, intracranial venous sinus stenting or CSF shunting. Okay, so just explain that some surgical procedures where they'll put some stenting, in the brain just to relieve the pressure in the brain. They can also be used if the medical treatment, the weight loss, are not helping with the symptoms. Thank you.